welcome to my channel. My name is Jazzy RN. If you're new here, welcome. If you're not new here, welcome back. The goal of my channel is to help nurses pivot from the bedside to remote work. And just a little background about me, I have over 9 years experience in utilization review. This company is Personify Health. Job is utilization review nurse, LVN or LPN. It is remote. I always go straight to the qualifications. And just in case you don't meet the qualifications, I still suggest you apply. This job is the weekdays from 8 a.m. to 5 p.m. Pacific time with rotating weekend coverage as required. This is normal to have rotating weekends as well as holidays. Requirements include a current LPN license in the U.S. or U.S. territory and 1+ years of clinical experience. Also knowledge of medical claims, ICD-10, CPT, HCPCS, HCPCS coding. Also right here where it says Microsoft Word, Excel, PowerPoint, and Outlook, make sure that you add platforms to your resume. Any software you currently use in your current job and your previous jobs, add this to your resume to make your resume more tech savvy. Excellent verbal written communication skills, ability to speak clearly and convey complex or technical information in a manner that others can understand, as well as ability to understand and interpret complex information from others. And I'm going to skip over these other bullet points. Compensation is $25 to $30 per hour. Next job is a case manager nurse RN. Qualifications for this job, same as the previous job, required to work evening and or weekend shifts. Must have an active RN license, a current California RN license, and a multi-state license will also be required. At least 5 years med-surg or acute care experience, and 2 years experience in case management or an equivalent combination of education and experience. Prior case management experience, ER, critical care background, or other relevant clinical care experience pertinent to case management. I'm going to skip some of these bullet points as well. And the pay for this job is $36 to $38 per hour. This next company is Icona, ICONA, and the job is a licensed vocational nurse, LPN. This job is $15 to $25.98 per hour. Qualifications for this job include at least 2 years experience as an LPN or LVN, prior authorization experience or case management experience, 3 years prior related clinical work experience. I'm going to skip some of these bullet points. And this job once more is with Icona, ICONMA. UF Health is hiring an RN clinical denial recovery analyst, enterprise denials remote, and you must reside in Florida, Georgia, Pennsylvania, North Carolina, South Carolina, Tennessee, or Texas. BSN is preferred but not required. An LPN or RN license in the state of Florida is required. They also require a CPC, COC, RHIT, RHIA, or CCS. This is preferred, not required. RN license, 2 to 3 years experience are for RNs, and for LPNs, 3 to 5 years experience clinical required. And coding medical record review, auditing or insurance experience is preferred, not required. Sutter Health is hiring a clinical triage nurse, labor and delivery, work from home. It is available for 9 locations. Pause to read. Moving on. Qualification for this job, you must have a work from home internet speeds of 15 megabits per second download and 5 megabits per second upload is required. Of course, a graduate from an accredited school of nursing, RN license for the state of California. You can submit application without a California license, but it must be required prior to your start date if selected. And an RN license in the state of residence. 2 years experience in practical nursing in a hospital, clinic, urgent care, or ER department. 2 years experience with several specialties and subspecialties. OB/GYN experience is helpful. And your shift is 40 hours, 32 hours, 30 hours, and 28-hour per week shifts are available. And the starting pay is $37.19 plus shift differential, which is non-negotiable. Advocate Healthcare is hiring a care transitions nurse for the weekends. This is first shift, part-time. The pay is $35.50 to $53.25. It is 20 hours per week. This job is fully remote. High-speed internet is required. Your hours are from 8 to 20:30 and will include holiday, and it's every weekend. Illinois RN license is required. Henry Ford has several positions available. This first one is an RN Access Care UMC remote. Works 24 hours. This is midnights for Detroit, Michigan. You'll work 24 hours per week. The shift is midnights. You'll work every other weekend and holiday rotations. You must be within driving distance of Elijah McCoy Building in downtown Detroit for the purposes of ongoing training and if the internet is down at your remote location. This job, you must be an RN in the state of Michigan. Next position with the same hospital, Henry Ford Health, RN Nurse, Access Care UMC remote, work 36 hours afternoon. This is also Detroit. 36 hours per week. You have 12-hour shifts, work every other weekend and holiday rotations. The same as the previous job, you must live within driving distance of Elijah McCoy Building in downtown Detroit. Next job is RN Access Care UMC remote, work days. This is 36 hours. You work every other weekend and holiday rotation. Same as the previous job regarding living within driving distance of Elijah McCoy Building. And you must be an RN in the state of Michigan for all these jobs. And the last job with Henry Ford Health is an RN Coordinator, Clinical Denial Recovery, full-time remote. This is for Michigan residents. You must have an RN license in the state of Michigan, at least 3 to 5 years clinical experience required. A BSN is required, or 3 years of denial, appeal, utilization management experience, and knowledge of hospital billing and payer regulations, including criteria for patient status determination and tools or software used for determination. Providence Swedish is hiring a supervisor, care management RN, administrative services. This job is full-time, day shift. You must have a Washington RN license upon hire. 5 years clinical nursing, include acute care hospital and or ambulatory clinic experience. They prefer you to have a BSN and 3 years of case management experience, including care management, care coordination, discharge planning, or population health. The pay range is $62.90 to $99.31 per hour. Call for Help is hiring an LPN part-time call center remote. You must have a compact license required. The pay rate is $24 per hour. Qualifications include an LPN license, 5 years of full-time clinical experience as an LPN, particularly in primary care for adult, pediatric, and geriatric patients, experience in OB/GYN, orthopedic, ambulatory care, or home care are also preferred. Experience using at least 2 electronic health record systems is required. So just make sure your resume has the platform or software you are familiar with. That's Epic, Cerner, Protouch, Meditech, etc. And an active, unencumbered ENCL or Enhanced Nurse Licensure Compact License. An additional non-compact state licensure would be considered an asset. Candidates should also be willing to obtain additional licenses at the company's request. Next position, this is with Ascension. The job is an RN transfer center. This is remote, day shift, and it says here PRN. The pay range is $35.88 to $50.65. You must live within 1 hour of Nashville, Tennessee. You must be an RN prior to hire date or job transfer date. A BLS is preferred through American Heart Association or American Red Cross. A BSN is preferred, as well as 3 years of bedside nursing experience and 2 years of experience in critical care, ICU, ED, and charge nurse or some type of leadership would also be preferred. Next job is an RN Senior Director, Professional Development. This job is full-time, remote, and day shift. The pay is $146 to $248 per year. Must be an RN. A master's degree is required. 5 years of work experience is required. 10 years is preferred. 2 years of leadership or management experience is required, and 5 years of leadership or management experience is preferred. Here are the additional preferences. You can read at your leisure. Next job is a Chief Nursing Officer, Ascension Living. This job is full-time, day shift. This also is remote with weekly travel if you're interested in a little bit of travel. The salary is $193,000 to $260,000 per year. Requirements: RN license, a BSN or diploma is required. A master's degree or combination of bachelor's degree and experience is preferred. Required of 5 years experience, preferred 10 years. Required 2 years of leadership or management experience, and preferred 5 years of leadership or management. And here's some information regarding additional preferences. You can read at your leisure. Next job is Director of Nursing Practice. This is a full-time remote job. It is day shift. The salary is $129,000 to $183,000. Requirements: RN license, BLS within 1 month of hire or job transfer date. Master's degree in nursing is required. WellSky is hiring for an authorization management clinical reviewer. This job is fully remote. It is full-time. Here are the business hours: 8 a.m. to 8 p.m. Staggered shifts, Eastern time on weekdays, and on Saturdays from 8 a.m. to 4 p.m. on Saturdays, and 12 p.m. to 4 p.m. on Sundays. Shifts are 4 10-hour shifts with weekend 1 to 4 rotation. Flexibility to cover additional shifts as needed. Must have a bachelor's degree or equivalent work experience, active RN license, 4 to 6 years of experience, 2 years clinical acute nursing experience, and 1 to 2 years of hospital-based utilization management experience. And here are the preferred qualifications. You can read this at your leisure as well. Blue Cross and Blue Shield of North Dakota is hiring a medical and behavioral health case manager. This job is full-time. The salary is $66,000 to $106,000 per year. Qualifications include associate's degree in nursing and completion of an RN program. A BSN is preferred. 3 years experience in clinical or related experience. Previous case management experience is preferred. North Dakota RN license or RN license valid for work in North Dakota. Medicaid experience is preferred. I'm going to skip some of these bullet points. You can read at your leisure. Next company is CentralWell. The job is a care manager, telephonic nurse. This job is available in 5 locations. It is full-time. Here are the work hours for the position. You can pause to read at your convenience. You must have a BSN. This is required. 3 to 5 years clinical acute care experience. Licensed RN in the appropriate state with no disciplinary action. You must live in Ohio, Kentucky, Florida, Arizona, or Texas. Comprehensive knowledge of Microsoft Office. Make sure you do add those platforms to your resume, including Microsoft Office. And you can read these bullet points at your leisure. And here are some additional bullet points as well. Travel while this job is remote. Occasional travel to Humana's offices for training and meetings may be required. And NHC, National Healthcare Center, is hiring a triage licensed practical nurse. This is part-time. The pay is $25 to $30 per hour. Must be a nurse LPN in a compact state or licensed in the following states. That includes Tennessee, South Carolina, Missouri, Virginia, and Georgia. Home health and or hospice experience is required. A graduate of nursing school, LPN school, or vocational school. 2 years of relevant experience in nursing and our telephonic triage. And post-acute provider experience preferred. And just a FYI, make sure your resume focuses on these 3 things: what you did, why it's important, and how it relates to the job that you want.